Antidepressant medications you must know for the Nclex. And as usual, we start with a quiz. The nurse should tell the client to avoid which item while taking phenyl sulfate. Okay, so this is an evaluation question. And I know that phenyl sulfate is a monoamine oxidase inhibitor. Is also an antidepressant medication, and the client taking a monoamine oxidase inhibitor needs to avoid foods containing tyramine. Consuming tyramine containing foods when taking an MAOI can cause hypertensive crisis. So the individual must avoid taking aged cheeses. So this is one that he needs to avoid. He also needs to avoid alcoholic beverages, avocados, bananas, caffeine drinks, and all of that. So option 3 is my correct answer. So we're looking at antidepressants, and these are used to treat various forms of depression, usually in conjunction with psychotherapy. They also have other uses, such as for anxiety, chronic pain syndrome, smoking cessation, eating disorders, or obsessive compulsive disorder. So we know these antidepressants, they cause increased concentration of neurotransmitters, meaning they interfere with the monoamine oxidase function. And remember, monoamine oxidase is that enzyme that inactivates your norepinephrine, your dopamine, your epinephrine, and your 5-HT or your serotonin. So it inactivates it and allows increased concentrations of these enzymes. So since it's interfering with these enzymes, it allows for increased concentration of them, leading to stabilization of the client's mood. So what examples do we have? You have your Panate or your trancypromine sulfate. We also have Nadil or phenazine sulfate. We also have Maplan or your isocarboxide. So again, Panate, Nadil, Maplan. And if you look at them, this is a giveaway here. Panama. So I remember it with Panama. Panama. They all start with or have that same sound. So these are your antidepressants. Let's look at side effects of these antidepressants. We know they could lead to hypertensive crisis, which is a medical emergency. And what do you see when a patient is in hypertensive crisis? There's going to be that profound headache, sweating, palpitations. They could have this stiff neck. They could even experience seizures. And this hypertensive crisis occur when these medications are taken with foods that contain tyramine. And we said some of these foods include your aged cheese, bologna, pepperoni, bananas, your raisins, your beer, or even over-the-counter medications like your ephedrine or pseudoephedrine. Another side effects with these antidepressants are the photosensitivity you could see in your client. There could also be weight gain. You could also see sexual dysfunction and orthostatic hypotension. In terms of our nursing consideration, you want to educate your client to avoid foods that contain tyramine. Again, your aged cheese, your pepperoni, salami, bananas, raisin, beer or beer, red wine, yogurt, sour cream, pickled products. You also want to monitor the client's blood pressure because of this possible hypertensive crisis. And again, you want to educate the client that it could take up to 4 weeks to start seeing effects of this medication. Don't give these medications with amphetamines or methyl dopa or levodopa. You also want to avoid opioid analgesics. With opioid analgesics, the clients may have hypo or hypertension. They could have coma. They could go into convulsions or even death. So there's this additive effect with insulins or high oral glycemics. So if the client is on an MAOI, they have these additive effects on their blood levels, they go into hypoglycemic crisis because of that additive effect of your antidepressants. Again, you want to avoid use of other CNS depressants, including alcohol. And the client is scheduled for surgery, these MAOIs needs to be discontinued at least 10 days prior to general anesthesia, because there's also an additive hypotensive effect when given with anesthesia. So we know that the MAOIs can lower seizure threshold, and because of that side effect with photosensitivity, we teach the client to also stay out of the sun. With your SSRIs, which are your selective serotonin reuptake inhibitors, this inhibits CNS uptake of serotonin. So it blocks the reuptake of serotonin in the CNS. So it acts as a stimulant, counteracting depression and increasing motivation. So the examples we have are your fluoxetine, we have your paroxetine, there's also sertraline, which is your Zoloft. We also have citalopram. So these are examples of your SSRIs. They are used for depression or major depressive disorders, for obsessive compulsive disorders, eating disorders, panic or anxiety disorders, phobias, PTSD, and also for premenstrual dysphoric disorders. So this is a health problem that is similar to premenstrual syndrome, but it's more serious. So with our SSRI, what side effects do we see? There's anxiety, there's GI upsets, there's also, it could cause urinary retention, it could cause sexual dysfunction, it could also cause dry mouth, and then we could also see insomnia. So as part of your nursing consideration, you want to initiate suicide precaution because it increases motivation for a client who's been depressed. So you want to initiate suicide precautions and tell the client it will take 4 weeks to get full therapeutic effect. The client should take in the morning because of the side effect with the client experiencing insomnia. So you want him to take the drug in the morning. Oral fluids needs to be encouraged, and good mouth care due to the dry mouth we talked about. And again, do not administer SSRIs with your MAOIs because the client can develop serotonin syndrome, which is also a medical emergency. So what are your MOIs again? We just talked about them. Your tranylcypromine, which is your Panate, your phenelzine sulfate, which is your Nadil, and your isocarboxazide, which is your Maplan. With tricyclic antidepressants, they also inhibit reuptake of neurotransmitters, specifically your norepinephrine and serotonin. They can also have anticholinergic effects in the central nervous system, as well as at peripheral receptors. What examples of your tricyclics do we have? There's amitriptyline, and there's also imipramine. So these are 2 examples of your tricyclic antidepressants. They are used for depression. They could also be used for sleep apnea, for insomnia. And imipramine is also used in children with bedwetting or enuresis. And what are the side effects you would see with this medication use? It could cause the client, you could see sedation, you could see those anticholinergic effects like the dry mouth, blurred vision. There could be confusion in your client. So you need to be conscious of that for safety reasons. Again, there could be postural hypotension, there could be photosensitivity, and you could also see bone marrow depression in this client. You could also see those urinary retentions also. In terms of our nursing consideration, you want to monitor the client for suicide because we said it increases their motivation, so you want to initiate suicide precaution. It may be administered in daily dose at night to promote sleep, and again, decrease the adverse effect that is seen during the day. You want to educate your client. It could take 2 to 4 weeks before you start seeing effects of this medication. Monitor vital signs because of the risks of orthostatic hypotension, and lab work also for bone marrow depression, because the client is at risk for leukopenia, is at risk for anemia, is at risk for thrombocytopenia. So we want to monitor for bone marrow depression. Do not stop this drug abruptly, as a client could have headaches, vertigo, nightmares, malaise, and even weight changes. Educate the client to avoid alcohol, avoid sleeping aids and over-the-counter medications, avoid sun due to the risks of photosensitivity. Don't administer tricyclic antidepressants with MAOIs. Again, the anticholinergic and sedative effects could be greater if the client is elderly, so you want to monitor for that. Tricyclic antidepressants could prevent therapeutic response with some antihypertensives. That's another reason for you to monitor his vital signs. Increase your PO fluids, give the client sugarless gum, sugarless candy, prevent constipation by pushing fluids, exercise, plenty of fiber in the diet. Remember, all of this is from the anticholinergic effects. And again, we know that the tricyclic antidepressants can also decrease seizure thresholds. With your heterocyclics, your trazodone, your bupropion. So these are our heterocyclics antidepressants, and we know that they alter effects of serotonin on the CNS. They can also affect norepinephrine and dopamine levels. They are used for depression. They can also be used for smoking cessation. Again, you will see these cholinergic effects, side effects like your dry mouth. You could see nausea. With bupropion, you would usually see insomnia and agitation. But with trazodone, you could see sedation and could also see orthostatic hypotension. In terms of our nursing consideration, advise your client, educate your client to avoid alcohol and CNS depressants, and also note that bupropion can lower seizure threshold.